everybody. Thank you for joining me today. Today, I'd like to discuss health literacy in our advanced age population. As you may know, inadequate health literacy disproportionately affects older adults in the United States. Adults 65 years or older are the fastest growing segment in the U.S., according to the Federal Agency Forum on Age-Related Statistics. Low health literacy among the elderly is associated with higher hospitalization rates, inability to manage chronic illnesses, and increased mortality rates. We have been experiencing increased non-compliance amongst our advanced age patients with regards to medications and following physicians' advice and directions. Many of our advanced age patients suffer from chronic illnesses, and it's so important that they follow the physician's advice and take their medications. It's imperative for their health care. Following the physician's advice can make a difference in managing and coping with their illness. There are various reasons that patients may be non-compliant, such as dementia, hearing loss, language barriers, or just may be embarrassed to ask the physician questions, maybe because they don't want to appear uninformed or not smart. I propose a plan here in our clinic to educate or help educate our advanced age patients by coordinating and overseeing monthly Q&A group discussions. In alignment with culturally and linguistically appropriate services, we will have an interpreter present for our Spanish-speaking older patients. The meetings will be coordinated by our office supervisor and a staff member on duty that day for that month. One of our clinic nurses or physician's assistant will be available to answer the medical questions for the patients related to that monthly topic. Every other month, we will have a volunteer community outreach person that will facilitate our meeting and answer questions that the patients may have related to that monthly topic. The discussions will be conducted in our conference room at 1 p.m. and we will post a flyer a couple of weeks before our meeting, and we'll just post a flyer in the waiting room and on the clinic door, giving the time, the topic of the discussion, and then the time and the date, and then bullet points on what will be addressed during that discussion. We'll have a sign-in sheet that will only allot for 15 patients to sign up, so that will give ample time or equal time for each patient to engage in the discussion. Family members and healthcare providers are definitely welcome to sit in or ask questions. The cost of the pamphlets will actually hand out easy to read pamphlets relating to that topic of that month, and the cost for the pamphlets for 50 custom pamphlets will be $25, and then the interpreter charges $75 an hour. So it's only $100, a total cost of $100 for the clinic. The patient will not be charged. This discussion participation will be at no cost to the patient. I believe this is a great opportunity to assist the older adults within our community and help to decrease healthcare disparities and health literacy. We can do our part in promoting health literacy by providing important information to our older adult patients that pertain to their specific healthcare needs. We'll be able to provide a comfortable place for them. It's a quiet setting, a quiet atmosphere. They may be more comfortable asking questions to the nurse and the physician's assistant without the time constraints such as an office visit. I believe educating the older population on healthcare is crucial for sustaining good health and improving quality of life And I believe as a team here in our clinic, we can work together, come together, and we can definitely make a difference. Thank you for joining me.